Hi. Okay, so this is the face palpations. So I'm going to start with the frontal bone, and I'm just checking to make sure everything is okay. There's no pain. We're going around the orbital socket and feeling for these bones. And then I'm going to go up to the nasal bone, and then the nasal cartilage. And then I'm going to feel for the zygomatic bone, and then the maxilla. And then I'm going to check her temporomandibular joint. Can you open your mouth for me? Okay, and what I'm looking for here is to make sure that they're opening evenly and there's no malocclusion of the jaw, and there's no popping or clicking. And then I'm going to feel the mandible. Everything is good here. And then the periauricular area and the external ear, and then the hyoid bone. Can you swallow for me? Okay, cool. And then now I'm going to do the teeth. Okay, so with this, I'm going to start. Open your mouth, please. Okay, I'm going to start in the first quadrant. And I'm going to go all the way back to. Do you have? Wait, close your mouth. Do you have your wisdom teeth? No? Okay, so go ahead and open again. Okay, so this is the second tooth I'm feeling, and then I'm going to go, and I'm going to push in all directions and make sure that they're not loose or anything's wrong with them. And then I'm going to go 3, 4, I don't know if I'm supposed to count, but yeah, 8 and 9. And then I'm going to go into the second quadrant.
I tickled, sorry. It tickled my lip.
Oh. Cavity.
It tickled my lip. Sorry. Okay, go.
Okay. And then all the way back. Make sure everything's good. Okay. Third quadrant. Okay. And the fourth quadrant. And what she has missing, or should, since she has no wisdom teeth, are her first, 16th, 17th, and 32nd teeth. So next is the inspection of the ear, and what I'm going to start with is the external view of it. And so, I mean, you don't have to show me, so it's fine. Okay, so what I'm going to look for is the external ear and see if there's any hematomas or signs of anything that could be an indication of bruising or blood in the area. And then I'm going to check behind the ear for enlarged lymph nodes or bruising that can indicate battle sign or a fracture of the skull. And then now I'm going to use the otoscope to check her tympanic membrane, and so I pull back on the ear and look inside, and I'm just looking for the tympanic membrane to look opaque or clear and not yellow or green or red that could indicate an infection or illness. Okay, so for inspection of the nose, what I'm going to look for is right off the bat, I'm looking for what's called raccoon eyes, which is just bruising around the eyes or right above the nose area. And then I'm going to check the external view of her nose for any any alignment issues like deviations or signs of fracture. And then I want to look into her nose at the septum, ignore my flashlight, and see if there's any deviations there. And I'm also looking at the mucosa and making sure there's no signs of infection with that. It should be a pinkish color, but not overly red or green or yellow in color. Okay, so for inspection of the mouth and jaw area, what I'm going to look for first is the lips and see if there's any bleeding or cracking or any signs of things like herpes on the mouth. And then I'm also going to check her teeth, so smile for me, and see if there's any chips or alignment issues with that. And then, okay, I don't have any gloves on right now, but smile. And then I'm gonna just smile, don't open your mouth. And I'm checking her gums right now. I just want to see if they're the right color. They should be a pinkish color, but not super red or swollen. that could indicate something going wrong in the root or with the teeth. And then stick your tongue out for me. And with this, I'm just checking for any lacerations. Lift your tongue. And then I'm looking at the lingual frenulum to see if it's intact in there, if there's any issues with that. And that's it. So for the inspection of the face and jaw, what I'm mainly looking for is any bruising or of the face or cheeks or anything like that with the zygomatic bones, all those bones in there. And I'm looking for malalignment of the jaw. So right now it looks fine. Smile for me. It still looks fine. There's no malalignment. And then I'm looking for the muscle tone to see if one side's drooping or tighter than the other. So we can work on that if we need to. So now I'm going to go into the pupil reaction, and I have a light here that I'm going to use, and I'm just looking for the pupils to be equal and reactive to light. So look straight at me, please, not at the camera. And I'm just going to go into the side here and make sure that the pupils are constricting when the light comes near and dilating when it goes away. That one's good. And then same thing with this one. And that's good. And then I'm going to go into pupil tracking. And what I want you to do is look at the center of this pen, and I'm going to move it around, and you just follow it without moving your head. And I want to go left to right and up and down. And then I also want to go in diagonals and make sure that there's no shakiness of the muscles and everything goes smoothly and she can go in full range. Okay, next is the Snellen eye chart, and what we're going to do is pretend that it's over there, 20 feet away, and that we're standing, and that we have a little cup to cover her eye. Anyways, what this does is there's letters on the page, and we're going to have her read down the list as far as she can, and once she gets to a list that she misses one, we go back up to the one above it, and if she can read that one fully through, then that is her vision, and whatever number it is, whether it's 2020, 2015, the first number is 20 feet, what you see at whatever the bottom number is, so like 2015, she sees at 15 feet what other people see at 20. So how we would start this is I would have you cover, what's your dominant eye? Right eye? You can talk if you want. So I would have you cover your right eye, and then I'll say read line number 5, and you would read line number 5. If you're good, then we move down one.
Can't see it.
If you're not good, we move up one.
Can't see it.
Until she can read a line fully through, and that is her vision. And then we would have her cover her left eye, and then do the same thing, and then she would read it with both eyes. And we want to make sure that if she wears glasses, she does the exam with her glasses on, because that is what her prescription is used for. If she didn't bring her glasses, then we would just note that she wears glasses normally. Okay, so next is the retinal exam, and I'm going to use my ophthalmoscope. So first I want to set it to my eyes, and right now the black number's at 0. So how we do this is we look at something across the room, and we focus on that, and then what I want to do is turn the dial until that image is perfectly clear. And there. Okay, so my number is 4. And this is for the longer range view of the eye, so what I'm going to do is look at her from, okay. And if I'm looking at the left eye, I want to be like lined up to her eye, and I'm going to hold this in my left hand and look. So I'm going to get really close, and okay, you look straight ahead. And right now I'm just looking at her iris and the color of it and the pupil, and making sure that there's no lacerations that I can see or anything wrong with that. And I'm also looking at the cornea and seeing if there's any lacerations or anything that's sticking out that seems wrong. And next for the close range one, I'm going to look at the back of my hand, and what I do is I turn the dial until I can see the lines on my hand, and it takes a while. Okay, so my number is -3. Okay, so now with this one you get even closer because you want to look into the pupil, and it's important to make sure that you're looking straight at the pupil. So look at something on the wall behind me, straight ahead, not up. Got it? Okay, and now stay focused on that as I move forward. And same hand placement for this. You want to be lined up with her perfectly. And then you go in, and you have to get really close. And if you're not comfortable with like your proprioception, you're gonna have to like hold onto their forehead, and so that your head will hit your hand before you hit them. And so you look into the pupil, and sometimes you might need a light, but the goal of this is to see into, like, through the pupil into the back of the eye and see the retina, and you can actually see the God, what's it called? The optic nerve. You're gonna look for the optic nerve, which is actually the eye's blind spot, and you can also see all the like red lines in the retina, and those are the rods and cones. And